Quickly. So you got the review recording and everything? Okay, so that got taken care of. So I didn't get that done until yesterday afternoon. Hopefully this will work. My other webcam is finally, I think, spit the bit. We got it. We got them around when COVID hit here. So it's the better part of 6 years old. So I guess it's entitled. So hopefully the sound will be fine. If not, I'll have to do it directly off. Hopefully I won't have to redo it on the computer at home. But nevertheless, that's what we're doing. So let us begin from that point. So I'm going to finish neurotransmitters and then introduce and that concludes the test material. What will go on after that is then the next unit at a minimum, and I don't know if I'm adding anything to it, but at a minimum will be endocrine system and autonomic nervous system. That's our second unit. That may be all there is because there'll probably be a lab exam involved, but we'll get to that. And we'll do lab. We'll be more catching up on special senses. I don't know if I'm going to do another little technology thing, but I might. All that good stuff. That'll be for Monday. More about that when the time comes. And again, a week from Monday is the exam on the 23rd. Back to the PowerPoint. Okay. So this is where we left it. You'll remember. And I think what's important to realize, effectively, the foods we ingest, X amount of them, either directly or by whatever conversion. I don't think, isn't tyrosine isn't one of the 20? We make it from something. I didn't take the biochemistry in the last 20 years, 30 years, 50 years. Does tyrosine come from what other amino acid? Or is it one of the 20 we typically ingest? I don't remember.
It's one of the 20.
Hey, good. But it's not an essential amino acid, as I recall. I don't recall. It doesn't matter. But nevertheless, tyrosine's a big player because we're going to see it in thyroid hormone, which is coming up in the next unit. So effectively what happens, we lop off the amino group, and now we have what's called a biogenic amine. Biogenic amines are really important. You're going to see these play a pivotal role. We talked about it a little bit last term when we talked about aspects of some of the. I'm trying to think of the best way to frame that. We were looking at anatomical structures, and we were looking particularly at dopamine pathways in the brain. You might remember. So these dopamine and norepinephrine are typically produced in the midbrain and play a significant role in both the autonomic nervous system and a lot of those pathways, the pathways associated with Parkinson's, the pathways associated with addictive disease. They are big players. And so to remember, they come from tyrosine. Of note, when you have, and it's certain, this is when people have trouble with certain foods that are rich in certain kinds of foods produce problems. Tyrosine is one of them. So a lot of people have to restrict their diet because they have an effect like what we call the catecholamines. Originally, the catecholamines we thought were responsible for a lot of depression at insufficient amount. And they used to use agents and a lot of medications, you'll see this if you go into a medical field. The warning on the label from the pharmacy would be to, if you're on what are called MAO inhibitors, that was a fancy name for monoamine oxidase inhibitors. They were something that were used a lot to treat depression. They had a lot of side effects. And so if you ate foods that were rich in tyrosine, this would produce headaches and high blood pressure and heart palpitations, a lot of secondary problems in this. We don't think that their implication is to say we know they play a role, but we think that a lot of particularly aspects of depression were associated. We use serotonin much more today than that. So that's something that's worth noting. We're going to look at these, the norepinephrine and epinephrine, particularly. Your hair is different, so you're acting different.
I forgot to take my medicine.
Okay, whatever. Thank you for sharing, but if you heard the expression TMI, I'm like that. You all get too much information about me all the time. So you're entitled. We're ecstatic to have you at any event. Which brings us, I like everybody. Yeah, almost everybody. I certainly like everybody here. Indolamines. So again, the conversion to indole is accomplished by two of these. Again, I don't recall the chemistry all those years ago. Tryptophan and histidine. So serotonin, very significant. So serotonin to me is maybe the one we are utilizing the most. I've commented on it previously. SSRIs, selective serotonin reuptake inhibitors. Selective because we know that there are subsets of serotonin receptors. And then pharmacologically, we can tell. So whether you're talking about Paxil, Prozac, Zoloft, which were the earlier, and they keep coming out with different ones, and they're all about side effect packages and targeting certain receptors. Risperidol, risperidone, where this, and unfortunately, none of them are what we call panacea. There's nothing perfect in any of those. So it's a question of, to some extent, trial and error, and they take time to work. There's no quick fix. A lot of times when somebody says, "Oh, we're going to put you on Paxil or Prozac," and it's going to, and then they come back a week later just to see how they're doing, and they go, "Boy, I never felt better. This works." And the reality is, over time, by prolonging the amount of serotonin at that receptor, it alters the receptor. 1 week is not enough. That's a placebo effect. That's it. It's that I just took 2 Tylenol and my headache's going away. 5 minutes. Doesn't work that way. The absorption isn't that correct. So a lot of times that's what we call a placebo effect. You see a lot of those with patients. They're just looking for some, not realizing the pharmacology of it. So the other thing with tryptophan is one of the effects of serotonin is it makes you drowsy. And the food that we encounter the most that makes us drowsy that we eat on a typically normal basis is turkey. So if you wonder why you're sleepy after the big Thanksgiving turkey, I mean, for most of us, it's the turkey. The red wine, though it doesn't necessarily complement the turkey as well, it doesn't necessarily it is not necessarily the only factor. So a lot of people are like, or it could be a boring game. Go figure. Help me. So tryptophan is part of that, and histamine. Histamine, we become conditioned to, oh, it's in mast cells, as you will learn, and it's in basophils, as you will learn, and they play a role in allergies, and I'm aware of that. But the reality is that there are histamine receptors in the brain. There are histamine receptors that are associated with the respiratory area, upper and lower, that are associated with allergy and indeed asthma. And there are histamine receptors in the gut. So we call them H2 receptors. So when you see some of these, like a Zantac, one of them was, I think Zantac was the one that was banned. And I have to go back and look at them because I don't take them. And so there are proton pump blockers like Prilosec or Nexium. But if you go and you'll see some of the ones that are over the counter in the pharmacy, they are histamine 2 blockers. So they work differently to reduce the amount of stomach acidity that are there. And so they come from histidine. So it has more, the fact that we talk about, oh, it's an antihistamine, you can't take a Zyrtec and have that help your stomach. It doesn't work that way. So I have to go back and look at those agents that are available now. I think the Zantac that was the one that was removed from the market because there were some side effects and some cancers that over time that they began to identify with. So play a lot of roles, different things. The autonomic nervous system, you're going to see the major neurotransmitter in that is norepinephrine by a wide margin. And yeah, I will agree that sometimes they're associated with mental illnesses, but I don't think our therapeutics are geared to it the way that they were used to. That's a really important category. What's very interesting about this category, these agents are not, remember, acetylcholine, you're moving ionic particles. It moves very quickly. Sodium in, potassium out, you get quick responses. That placebo effect is, and the fact that it takes typically 2 weeks, 4 weeks, even up to 2 months to see an effect with sometimes uses of this therapy, is these are typically G protein passageways that take, so it's a lot of second messenger systems, and those tend to take more time. safe. So the next category, and some of these work a lot faster, are the amino acids. They are very important. So it's difficult which are, but we know ones that are proven. You must know these four. Just the way you need to be familiar with dopamine, norepinephrine, and epinephrine for the exam, serotonin for the exam. When it comes to the exam, these four. Glutamate and aspartate, they're just glutamic acid and aspartic acid. The only thing is, when you put them in water, then alcohol goes away the proton. Now we call them glutamate and aspartate. Doesn't matter. This isn't biochem class at all. They are consistently excitatory. Consistently. We very often think that the manifestations of a stroke and the flexion contractions that are we see so much in the nerves that are the first of them. Remember, it's a two-nerve system, the upper motor neurons. That's where we think that glutamate plays a big player. We see a lot of glutamate productions from damaged motor nerves. Not so much the ones going to the muscle, but the ones that are within the central nervous system. Glycine and GABA are consistently inhibitory. They work by chloride-gated channels. The way that they are hyperpolarizing agents is because they open channels that allow chloride, which will hyperpolarize and lower the resting membrane potential consistently in most cells. I think I told you about it. I just finished the latest Dan Brown book. I mean, he does a lot of scientific research and research in a lot of areas, but what this was focusing on was people at death. He was looking at near-death experiences and the remarkable changes in GABA levels, interestingly enough. Why people get this historically, the bright light and all those kinds of things that people were discussing, which have been around forever for discussions with near-death experiences. Like the GABA levels, all of a sudden, rather than increasing, abruptly decreased. And so these normally pathways that were inhibited were no longer inhibited. I mean, it's a 700-page book. It's a long book. It's a good read. Very interesting. So if you're in the mood to that, my son, for whatever, because he drives around so much, back and forth from Norfolk to DC, he likes, and he drives around other areas. He likes audiobooks. I never got into those. I like to read it myself, but it's okay. So those are all important. We'll go over which ones and some of the excitatory and inhibitory as we go farther along today, and that's really what we're covering. I did load the autonomic nervous system, which we're going to start on Monday in lecture. We'll continue with special senses. I do special senses and nervous system, and then we go into, and then we'll do the cardiovascular unit in lab. You got to have heart. All you really need is heart. So, famous substance P. Okay, there's a lot of different things. These are strings of short neuropeptide trains, generally 8, 9, 10 short chains of neuropeptides that we can duplicate. One is called substance P. This is one of the things, remember I talked a little bit about the action that worked in about a third of the individuals when they were using capsaicin red pepper extract creams for arthritis? They deplete substance P in surface nerves. So nerves going to bones, joints, superficially, that's how they work. They're inconsistent because my wife tried it for her nerve pain, couldn't tolerate it, just irritated too much. And so it's about a third people, it's just intolerable because of the skin irritation. A third it works, and a third has no effect. And this is something that was consistent when it was prescription and first came to the market, 40 years ago, because we started to use a lot of it. Are you familiar with something called a TENS unit? Okay, in sport, they're used a lot. It's a gating mechanism. So really what you're doing is think of it as jamming radar. So you're sending a signal that doesn't allow the pain signals to go through. A now deceased friend of mine, he used to use a ton of them. post-operatively and had really good results. He would hook these folks. First, he did it on one side and not the other, and the patient would put that on the other side, put it on the other side. So he'd do bilateral cases, and he had a lot of good, really limited to have. One of the big problems if you go into a medical field that I found, and then I was a soft touch, to be very honest with you, is it's very tough to get people off pain pills. They're easy to get hooked on them. They start coming in and they want more Percocet and more which is oxycodone. It is a tough sell. It's very, very hard to get them off. And that really was, and I was a sucker for a sob story, which is, it's if you're going into a medical field, you need to maintain objectivity as much as possible. That was not my long suit. I got too involved with the patients. It's good for caring. It's bad for prescriptions. Endorphins, naturally occurring morphine analogs. That's what they are. It's this endogenous internal morphine-like substances we produce. Beta-endorphin, dynorphin, enkephalins, natural opiates, reducing pain perception. They don't take away the pain in the sense they don't cure the pain. It just means your brain doesn't perceive it. I mean, we started to understand these things, how people could run into a fire and rescue a loved one. It's it didn't hurt at all until afterwards, because they were producing this in high stress environments. People talked about in the early days of the running movement, which started in the late 60s and early 70s, where we started to see the advent of people running and jogging for health. They would talk about the runner's high. They were experiencing this in a marathon, going through that wall at like the 18-mile mark. And again, that probably played a certain role, I think, with a lot of it. So it was reducing the perception, not the presence of pain. And so they discovered these substances that were like that. And these are also, these peptides certainly played a role in regulating digestion. We sometimes think that they may play a role in I don't know about you, but when I eat something I really like it, I enjoy that. Happy dance. As I was telling Rachel, because she was in with Dr. Hillwig earlier, I mean, I made a really good noodle pudding dish like yesterday for my wife's church group. I made her a Jewish dish for the church group. No, why not? But I mean, I know what it's like when I eat something I like. Oh, happy dance.
How do people do that? Why do you dance when you get things every morning? Why do we do that?
I don't know.
Because every time I'm okay. My mom always makes fun of us. So why do we can only want?
Hey.
Why do we do that?
We do it. Behaviors are interesting in that regard. I mean, it's just you have it's. I'm still wondering. My daughter at her wedding, there wasn't one slow dance. She and all her buddies were having a great time with the techno lights and the. I don't. Remind me to show you the video. I think they saw it. My daughter's a trip, to say the least. Soon to be 40, and her friends are all in their 40s, going on 20. They all want to be that. Just enhancements. You saw them. You saw them. She's a trip. My daughter is wild. Look, I mean, I hope you have a great relationship with your parents. Heaven forbid, she's taken wonderful care of her mom. We're no longer married. And her mom needs a lot because she has disabilities, physical disabilities. But if I ever needed anything, she's there. And it's rare. And if she ever needs anything, I'm there. That's what it's about. Purines, okay? We know what purines are. The A's and the T's, the G's and the C, they're the A's and the G's. ATP, now considered a neurotransmitter. As it breaks down, we have adenosine. Caffeine is what we take because adenosine tends to make us tired and relaxed and sleepy. So what do we have? You have caffeine beverages all the time. Maybe you're a Red Bull fanatic. Maybe you're not. I'm a coffee drinker. And No decaf, thank you very much. And for years, I would rather have had a Pepsi first thing in the morning or Coke. The original blend of Coke, if you did not know, was a guy named Coca-Cola. The Coca was from cocaine, and the cola was from caffeine that they put into it. That's how they put that. That would have been a hit in my house back in the day. Caffeine was never a drug that was too expensive for us college kids. But I mean, in the spirit of transparency, we tried it. It was lasted for the buzz lasted for about 20 minutes. See you later. It was a fun 20 minutes. She's looking at me. She doesn't know me yet. And can induce calcium influx in astrocytes. So that's, I think that may be some way of the presentation, but we need to be familiar. And these are interesting still, gasotransmitters, gas transmitters, effectively. The one that is the most, because to me, carbon monoxide, even though we produce some of it, and hydrogen sulfide are more like more like the stuff that's coming out of the back of your car. If you're still using, if you're not using an electric vehicle, because who knows what's going on there, and we don't really know yet. And nitric oxide is very interesting. Nitric oxide is something when your blood vessels get stretched, in order to enhance their ability to stretch, they release, if they're too taut, okay, as they get pushed apart, they release this substance from the endothelium, the lining, and that's nitric oxide. So it makes it easier for things to pass through. Nitric oxide, we inhibit the breakdown of nitric oxide when we get into reproductive physiology. That's what, when you hear about ED medicines, they're all about that. There's a zillion of them, and they all basically do the same thing. They work on a pathway to keep that in the air because it keeps blood vessels dilated. And these ones go into the brain. They're lipid soluble. They're easy to get there. We're talking about learning. We think it has more about smooth muscle relaxation and areas in the brain. Like I was saying, it increases circulation to certain areas, and that may enhance learning. So we're just beginning to understand it. We didn't know about this when I learned about physiology. This was, we knew about the endogenous morphines. We knew about a lot of the neurotransmitters. Nitric oxide was not part of the discussion. So we're learning now, and if you work with stroke patients, you really can. And I mean, and I've shared it with you on numerous occasions. My granddaughter's cerebral palsy is a pediatric stroke survivor. What she's doing today, verbally, I'll get some things where I'll get you the Girl Scout cookie pitch one that she does, like all the little girls do. And I tried to maintain it. I'm a Thin Mint. My wife and I are Thin Mint addicts. I also brought some from Dr. Hannah from her daughter, so it's not like I don't keep it in house. I only bought 10 boxes this year. I got a box a night habit. So, and then these, not that you would have any familiarity with this, cannabinoids. We make them ourselves. They come from THC, tetrahydrocannabinol, the active ingredient in marijuana. We know now with its therapeutic usages. And we knew about the therapeutic usages before, but now we've been able to isolate them into the CBDs and the THCs and what they are. That it's a very complex molecule that in our bodies we break down into a variety of different compounds. We've only really scratched the surface of this interesting plant, for lack of a better term way to describe it. It works on G protein link receptors. It's lipid soluble. Take note of things that are lipid soluble and substances, because if most workplaces will test. So be aware that you should be free for about at least 30 to 60 days if you want to go into a quote drug-free workplace. I mean, I'm not telling you what to do, and if prescription and related things like medical needs, but things everybody needs to be aware of. I've made my own kids aware of it. Those are things like that. I was telling everybody, my middle one's got a CDL with hazmat. I mean, I remember even if somebody rear ends him and it happened, they escort him for a blood test, the very first thing. Even if he would have to go to the hospital, which he didn't, his company sent a driver there driving you to the hospital or to Quest to have a blood test now, or a urine test now. That's the first protocol. So, synthesized on demand, learning and memory, and this is we knew about them. They stimulated appetite when people took them back in the day. People didn't get nauseous. Pain medicines worked more efficiently, so we knew there were therapeutic benefits of a variety of marijuana-based products, or just using marijuana. I don't think I threw up for 15 years. Transparency, everybody. And the statute of limitations is over. If you wonder, the day I got my my doctorate, I stopped because I couldn't. Nah, it's not so much risk it. It's live with myself. If I made a mistake because I made a mistake, okay, because no one's perfect. But if I made a mistake because I couldn't control myself and be high, you know, that was a different thing. He never made a mistake. He does a lot of substances. Yes, he did. Okay. Insightfulness. No, I've always stayed away from those things because if I take one drink, I'm useless. I don't even. My wife has to drive. I have a limited tolerance for alcohol. I'm that person, so I don't bother with that. I said, "Are you okay to drive?" She goes, "What are you talking about, idiot?" Emphasizing the idiot. I'm just no good with that. I like to have my mind is everything in a lot of ways to me, so I need it to be sharp at all times. So that's it. And now we look more closely at what they do. Two classifications: effects and actions. Effects, excitatory versus inhibitory. One or the other. Rarely both. There are some again, we're going to memorize the exceptions like acetylcholine on the heart. Determined by the receptor. GABA and glycine, almost always inhibitory, chloride channels. Glutamate is usually excitatory, as is aspartate. Acetylcholine and norepinephrine bind to at least two different types. Acetylcholine is always, we know this, it's a neuromuscular junction, mostly in the brain, but it plays this is its major difference. And we will get to that in the next unit because that's where we do autonomic nervous system. That's where we do endocrine. But autonomic nervous system in particular, it slows down the heart rate, which is its job. It's supposed to do that. And it's a good thing. Direct versus indirect. Direct actions are rapid. When they open and close ion channels like acetylcholine at the neuromuscular junction, it's a rapid response. Anything that works its way by ions works rapidly. So acetylcholine and amino acids do this. It's at chloride gated channels, or whether they're sodium gated, it doesn't matter. Indirect actions, G passageways and second messengers, they take longer to affect. Okay, but the effects last longer. Biogenic amines, some of them. Okay, serotonin would be a good, again, dopamine, norepinephrine, serotonin are all in that category. Neuropeptides are in that category. Dissolved gases are in that category. So they take longer, but then their effects are much longer in nature. That's that typical month to 2 month when somebody starts on one of these for OCD, for eating disorders, for mild depression, which are used so commonly. They're used adjunctively in ADD. They've been around for a long time. So, the modulators are interesting still. They don't directly cause this, okay, but the strength of the synaptic transmission. So it plays a role whether it's neurotransmitter, release, degradation, or reuptake, postsynaptic membrane, very localized, Paracrines means they're released close to the area where they affect, like the synapse. There's a lot of medicines. One of the ways we do think that that's how certain hallucinogenic agents work, particularly LSD was one that was classically, I don't think we understand it that well. A lot of these agents, why they work that way. Things like ecstasy are basically powerful psychostimulants. They're sort of like speed on speed. That makes any sense. So they very much increase activity in certain circuitry that are there. So I mean, and that's a whole other. How amphetamines work by accelerating biological processes. These work on them in the brain. So I used to know. I taught a course on drugs in the human body. That I knew more about the chemistry I was associated with it. So there's three different subcategories of hallucinogenic agents. Like I said, I've tried them all back in the day. Good stuff. I mean, I really you could get into the periodic table, literally. Did you ever look at old album covers? I'll have to get some images or something. So back in the day, we didn't have screens and things like that. So whoever your group was, they had an album cover, and it was like we're. Oh, I gotta show you. You don't mind if I do this to keep your interest peaked. So where the Beatles come up with Revolver and Rubber Soul album covers. So if we look at images, here is Rubber Soul, and there's Revolver. Here's Rubber Soul. There's Revolver. I mean, all of a sudden, these album covers were very, very distinctive. And then the very famous where they come up with all this stuff. I mean, the whole idea of it. All these, I mean, so as George Harrison said, the late George Harrison said, he and John Lennon, with their wives at the time, with their first wives, went to a friend of theirs who was a dentist who introduced him to the dreaded lysergic. And things kind of changed a lot because of their music. Just saying. There's not a whole lot left of us who can teach you about the history of rock and roll and modern transitions into it. The whole onset of the British invasion. Got to work on you guys. Sorry. There are a lot of documentaries that you can watch about this. I mean, you can YouTube the heck out of this. Okay, moving on. So when you have ion channels, immediate and brief, sodium in, most common depolarizer, chloride in, the most common hyperpolarizer or inhibitory. And they're just showing you. The G protein ones are different. We'll talk in the next chapter about what muscarinic receptors are, or binding certain biogenic amines or neuropeptides. We'll look at some of those. And so you'll see those. See, the second messengers then do the ion channels, or we know kinase enzyme like tyrosine kinase and insulin, phosphorylation, activating different genetic transcription translation passageways. Okay, so there's the mechanism is somewhat understood, but it's all different with these. With when we start looking at neurotransmitters, and as you might guess, a lot of medications are sort of geared to simulating them and using them as a, and we've seen this one so many times I get sick of it. Okay, and I don't do any of that stuff. Not serial, I don't care about reflexes, simple reflex, receptor, effector, and at least something in the middle, although most of the time they have a lot more. All these different, I don't get it at all. But you might be taking neuroscience and you might get it. I don't get it. It means it doesn't interest me enough to talk about it. Right? And that concludes, not today, I'll give you a few minutes of introduction, but that effectively concludes the material for the first exam. You don't have to thank me, it's all on the surface. Unlike This is supposed to be the easiest of the exams because at least part of it's on the cell and you've had all that stuff before. As I've said to my 2 micro classes earlier today, don't F up. I had sent it, didn't I message it to you ages ago? What do you? Yeah, dear. Um,
Actually post it instead of emailing it.
you going to put it on there? I'll do that when I get home. If you don't see it by tomorrow, send me an email. I'll do it. I want to get home. There's soccer.
I want to get message.
No, we're getting there. Give me 5. Hey, stop being a pain, please. You're not a pain at all. Oh yeah, there's a message there. So this is what we're starting, the autonomic nervous system. So it is, even though we've anatomically, there's a reason why I skip it. I skip it because it's a physiological system. The anatomy is very straightforward. It's basically the system that controls us. Automatic would be a fine word to use for it. We do not have conscious control over this other than something extra. We can't electively say to your heart, slow down. And the reason why it's important, if you're going into a clinical field, a ton of medicines work by this system. You know somebody on an inhaler for their asthma? Because of this system. A lot of heart medications in this system. So you really need to be aware of this particular system as much as anything else. Because even if you're not going into a medical or clinical field, people you're going to know or you yourself are going to be, if you have to, you're going to be on medication, so it would be a good idea to be familiar with. So it's really, it's a very simple, comparatively speaking, 2-nerve circuit. And by definition, it's a motor system that goes, we call it the visceral motor system. Can we control it? Sure. Could you lower your heart rate? If you're adept at meditation, it will lower your heart rate. Where some people can lower it significantly. You can do it by modifying your behavior and your activities with exercise and diet and getting rid of bad habits and trying to, all of those kinds of things are ways that we can control this nervous system electively. But ordinarily, we don't have a lot of controls over it. We can't magically say, okay, do this or release this or anything along those lines. It doesn't work that way. So it's really, I don't care about your career. That was mean. So it innervates smooth muscles, the heart, and glands. If there's a system that's about homeostasis more than this, I'd like to see it. I really would. But this is homeostasis 101. Generally, they have almost nearly all the organs, not all. It's important to know the distinction between them. Have dual innervation. Elevate, increase the heart rate, lower the heart rate. That's what we're talking about. Secrete this, don't secrete this. So they make adjustments for optimal support of body activities. Blood moves around. Blood pressure is part of it. Digestion is part of it. Subconscious control. Involuntary, buy that. Automatic, I'll buy that. General visceral motor system by definition. Most people call it the autonomic nervous system, and the acronym ANS is perfect for it. The same illustration we've seen before. It's part of the peripheral nervous system because it comes from either cranial nerves or spinal nerves that are there. And it's divided into sympathetic, which is the action division right now, or the parasympathetic, which we call the rest and digest. Right now, we are, not necessarily me, because I'm having slightly more activity, not a lot, I haven't gotten up yet. But I had a muscle go into spasm when I was talking to Jacob before, so I'm using that as an excuse. He didn't produce it, my leg went into spasm. So we understand that right now you're mostly in full-blown parasympathetic. Most students are, most time, whether you're studying, whether you're listening to a lecture, whether you're watching a video or listening to a recording, that's what you do. Okay, hopefully your brain is functioning, but you're not utilizing your muscles. You don't have to accelerate your heart. Okay, it's just not what you do. It's the whole reason why when we get up in the morning, we don't have to go to the bathroom, because our rest and digest, our genitourinary and our digestive system is very, very active. The exact opposite when we're busy. Okay, and it's all about shunting the blood, as you will learn. So both have motor fibers, but differ in how the effectors and how they work, the pathways and where the ganglia are located, and the response of the target organ to the particular neurotransmitter. It's still a nervous system. Thankfully, there's only really two neurotransmitters effectively, acetylcholine, and it's a two nerve circuit, and acetylcholine is a three of the four possible. We have two nerves, one before, one after. Acetylcholine is there in three of the four possible areas. And the other one is norepinephrine. And there's a subtle difference when we get to what's called the adrenal medulla, which, even though most people will study it as an endocrine gland, and will certainly look at it as an endocrine gland, it is probably, and I am one of the people who subscribe to this, it is really part of the autonomic nervous system. Most authors, most experts agree that's why I learned it. So somatic nervous system involves nerves to skeletal muscles. We just spent an inordinately long amount of time in the first few weeks of this course learning about this is innervating cardiac, smooth muscle, and glands. Yes, in the interest of all of you, I can see this is going to disappoint you, but we'll pick up the rest of it starting on Monday. You don't have to thank me. It's all part of the service. I want to get out early too. My wife woke up with a sore throat, and I said I'd try to get home as quickly as possible. So thank you. I said, don't get sick. Someone has to take care of me.